The overarching theme of my research is around disasters and mass gatherings, high visibility, high consequence events such as sporting events, festivals and concerts that become disruptive to our normal way of operations within an emergency healthcare environment. So my research looks at how we provide adequate health services to people at the event itself, but also to ensure that we don't draw away community resources such as ambulances or emergency department operations because there is an event on. Major events themselves are a fabric to our community. So I started questioning what's the right amount of health resources, how many doctors, nurses, paramedics, first aiders should be at those events to limit the impact that we're seeing in our emergency departments so that we can develop some interventions and strategies. Traditionally, health and events haven't worked closely with one another around health response to major events. However, during the COVID pandemic, what we're seeing now is much more a close relationship between events and health. My work in relation to events and COVID have seen the development of the industry framework for COVID-safe events in Queensland. This sets out key public health principles which all events can implement to try and enhance a COVID-safe environment for participants and spectators of events. And additionally, it also brings together some event-specific characteristics, acknowledging that not all events are the same, and in fact, individual characteristics make up an event, and therefore we can apply different strategies to those events to try and enhance the safeness of those events and limit the transmission of COVID-19.